Hi, and welcome everybody to this webinar about the novel 2019 coronavirus, which we are calling COVID-19. This is Dr. Caitlin Padati. I'm the State Epidemiologist and Public Health Medical Director here at the Iowa Department of Public Health, and we'll be talking today specifically about COVID-19 and long-term care facilities. Just a little bit of housekeeping. For the webinar, everybody's actually going to be muted during the presentation, but you can submit questions through the question feature on your control panel, and please do that at any time. And after we're finished going through just a couple of slides, we can talk through some questions as well. This session is being recorded and it will be made available afterwards for reviewing. That will come through a link through email that you registered with. So I wanted to give just a brief update on the activity here in Iowa. I wanted to talk about the CMS and CDC recommendations. I wanted to share a specific request that we have for some enhanced surveillance, and then we can go ahead and open it up for questions. So I think that as many of you have seen over the weekend, we've really shifted even further, more fully into what I would call the mitigation phase of the response. So this means that, initially a lot of our efforts were focused on containment and identifying individual cases and following up with them. But as we've recognized, there are cases that now have no known risk factor and represent spread in the community, we're moving more towards using public health tools that are aimed at affecting people's movements broadly, which helps reduce person-to-person interaction overall throughout the state. So again, moving more into that mitigation phase. If you haven't seen it, the CDC does share a nice summary document about, in general, what some of these efforts look like. And they're things that I think you've heard us talk about before, things that I'm sure you've seen when we think about social distancing, canceling large events, particularly having our high-risk group people avoid going into crowds or being exposed to ill people. But that document does provide a nice summary. So when we talk about the specific guidance that I think many of you have seen come out from CMS, I'm sure you're well aware that that guidance is now recommending restricting visitors. And there are exceptions built into that for things like compassionate care or end-of-life situations, but that recommendation from CMS was effective immediately. So that does mean restricting volunteers and non-essential healthcare personnel, canceling group activities and communal dining, and implementing active screening of residents and healthcare personnel for fever and respiratory symptoms. And I know that that's a lot, and particularly around how to do some of the screening, whether that involves asking questions or taking temperatures, how to operationalize that, hopefully are things that may have come up before in some of the planning efforts for your facilities. And if not, there's some good resources that I think we can point you to also through CDC. And if you have additional questions more related to the regulatory side of this, DIA is probably the best point of contact, but if there are things we can do to help facilitate that, let us know. So, we want to recognize that a lot of the things we're describing here can be, really hard things. And we know that, again, there are implications of doing these sorts of things. So thinking about whether we can offer alternative means of communication for people who would otherwise visit, so things like phone, video conference, trying to either create or increase communication to help keep families updated, including advice on not to visit, I think is helpful. Consider assigning a staff member to be a primary point of contact for families who are calling and asking questions, and also trying to keep people as up to date as we can. And perhaps considering something like offering a phone line with a voice recording to help give people information about operating status and visiting policies and that sort of thing. The idea here, again, we recognize that these aren't small things to ask of people, and I think that the more we can help keep people informed, the better. We do also recognize that, depending on what else might be going on in a facility, there will certainly continue to be PPE needs. So keeping in mind, what you have available, what you might do if you, started to run low and needed to reach out. Think who your contacts at local public health and your EMA would be if you need to make those requests, but also thinking about ways that you can consider optimizing your current supply to help sort of make that last as long as possible. And the CDC does have some good guidance around ways to sort of do that, specifically related to N95s. To be clear, as a refresher, the CDC did update their infection control guidance with respect to COVID-19. So while initially we were really considering this, to be something that required airborne precautions, CDC has taken a look at the data that's been available so far and recognized that given shortage supplies or PPE supplies, that it's reasonable and safe to manage either suspected or confirmed patients with COVID-19 using contact and droplet with eye precaution or with eye protection. So that's going to mean a gown, gloves, a face mask or surgical mask, and eye protection. We also want to recommend that you think through what your communication plan might be if you think you have a suspected or confirmed case of COVID-19 in your facility and wanted or needed to transfer that individual. So thinking about, who you would contact, who you would reach out to ahead of time, to help share that information, what facility is likely to be engaged with you, if you needed to step up care, and having those points of contact readily available, how to share that information and make sure that people are using the appropriate precautions in doing this. We also want to make sure that, we're thinking about, your own staff within the facility. So ensuring that they're aware of the sick leave policies and know, that they should stay home if they're sick, particularly with respiratory symptoms. Advise people to, evaluate themselves for any signs of illness before coming in and to notify a supervisor immediately and if they become ill. We generally advise that people shouldn't require a healthcare provider's note for sick employees, just because, it's another sort of step that people would have to take to enter into the healthcare system, and it's probably not sort of the best use of, healthcare provider time and everybody's time. And so, considering not requiring that sort of thing, to keep things more simple. And then also thinking about your contingency plans for your facility. So, again, pulling out those pandemic plans that you might have from back in 2009 and thinking about if we had increased absenteeism, what would our plans be? If we had a certain percentage of people who couldn't make it in, could we extend hours? Would we cross-train? Would we reach out to, another organization to help assist? Kind of thinking through what those options might be. Certainly, in general, we always want to make sure that we're being supportive of good hand and respiratory hygiene as well as cough etiquette. So ensuring that everybody is cleaning their hands, including before and after contact with residents, contact with surfaces and equipment, and certainly after removing PPE. Making an alcohol-based hand rub available inside and outside of rooms, doing things like making sure tissues are available, sinks have soap and paper towel, to really make it as easy as possible, and as easy for people to just continue these good habits of frequent hand washing, which is going to be important for preventing the spread of a variety of illnesses. We'd also like you to think through within your facility, if you did have individuals who became ill with respiratory illness, do you have the ability to move those people to one particular area? Can you designate, pre-designated staff to care for those patients so staff aren't overlapping? Making sure that we're using the right supplies and doing the right and correct use of PPE. So having signage on resident rooms to sort of describe the kind of precautions that might be needed, making that PPE available immediately outside of a resident's room if they do need that, and positioning trash cans appropriately so that that can be discarded. And then also, again, just reinforcing that a big part of this is keeping everybody, residents, staff, families, everybody as informed as possible. We fully recognize that this has been, a lot going on and a quickly moving situation. And I think, again, the more information that we can share about what facilities are doing and the steps we take, the more comfortable people are, and the easier it is to have people, use those measures when they fully understand them. I did also want to note that we are asking at this time that if in your facility that you have 2 or more residents or staff who have a respiratory illness, we would like you to report that to IDPH at our 800 number there, 800-362-2736. We recommend, of course, that sick residents be isolated and that sick staff get sent home. Certainly using contact and droplet precautions with eye protection if you're caring for sick residents. We would like you to collect samples, a nasopharyngeal swab, an oropharyngeal swab for flu as well as COVID-19 testing. And we can, work with you to make sure that you're communicating so that we can get those samples picked up and sent out to SHL. And our goal here is to try and make sure that we're evaluating, not just for potential COVID-19, but also for flu, which we know is still widespread, we know is still circulating. And there are, of course, some additional measures that we might recommend, related to antivirals for flu. Certainly, I know that in large part, a lot of the visitor element has already been addressed, but certainly in the event of, ill employees and residents, closing to visitors would be advised, and canceling those kinds of activities if you haven't already done so, and adjusting meal service as well, although likely a lot of those steps have already been taken. So, I think there's been, again, a lot of changes in the past even couple of days, and I know that there's been a lot going on, and we're asking people to sort of keep up with a lot and implement a lot of things. We want to reiterate that we want to be as supportive as possible to you, and keeping in mind the big picture here. For the vast majority of people, about 80%, we think that COVID-19 causes a mild type of illness. And it's that 15 to 20% who have underlying conditions or who are older who seem to be more severely affected. And so those are the people that we really want to work hard to look out for and to protect. And we know that these are exactly the people that you guys are taking care of. And so, we want to make sure that we're being as supportive as we can. So it looks like we've got a couple questions. I'll turn now to the Q&A box. It looks like, will there be an exception for mandatory healthcare provider training requirements like ACLS or PALS or extensions beyond, certain cutoff dates? That's an interesting question. I don't have an answer readily available, but I can take that down and you can follow up with us afterwards and we can see if we can get that and share that. Are we being advised then to keep all residents in their rooms? I would take a look at the CMS guidance because that's really the regulatory guidance. Certainly our advice from IDPH is going to be that you'd want to consider doing that, certainly the ill residents in your facility. And the CMS guidance, I think at this point, is really recommending that as much as possible, we limit the interactions of these people. And I know that that's hard. I know that that has consequences. And so again, thinking through if there are other things that we can offer people, video or teleconferencing, I think will be important because we know that will be hard, particularly for an extended period of time. There's a question about, will the slides be available? Yes, we'll be sending those out and you're welcome to print them off. There's a question about, does the Department of Public Health have a system in place for delivery of PPE to SNFs or long-term carers that are experiencing trouble with PPE? If you are having a concern with your PPE supplies, please do reach out to local public health and to your EMA and ask them to help you make a request for PPE. There's a question about, is a sore throat still a question to be asked as part of the screening process? Yeah, sore throat has not been one of the prominent symptoms that COVID-19 patients have presented with. Some have had sore throat. The primary presentation has really been fever and dry cough, although some other symptoms have been reported. But regardless of whether we're talking about COVID-19 or any other illness, anybody who's sick with anything at all should not be coming to work. If somebody says they have a sore throat, we don't want them to be taking care of your residents. There's a question about, where do long-term care centers get viral kits if they don't have them on hand? So the swabs that are used for this testing are the same as the swabs that are used for flu testing. And so if you can work with either your area healthcare facility or local public health to reach out and see if you can get swabs. And if you're having trouble, you can also reach out to us at the state, particularly if you're reporting a cluster of respiratory illnesses. There's a question about recommendations for assisted living, which I realize is a little bit different, than some of the long-term care. Again, I think I would take a look at the CMS guidance, and I would also take a look at, some of the information that we've posted under the long-term care facility resources, and look at your own institution's pandemic plan and think through, again, the staffing concerns, visitor limitations, and ways to sort of think about reducing interactions or potential introductions of illness into your facility. If an employee tests positive for COVID-19, when can they return? Our advice is going to be that people who test positive can return 7 days after symptom onset and after they have been with symptoms that have improved and fever-free for 3 days, for 72 hours. And that's going to be our advice. What type of swabs do you use? They're flu swabs, the same swab that's used for testing for influenza, and the additional specific information for that can be found on the State Hygienic Laboratory webpage. How long does an employee have to remain fever-free? 3 days. What are the recommendations for allowing pregnant staff to work? Pregnant staff would be considered immunocompromised, and so thinking about ways to sort of either reassign them if possible or help them avoid working with high-risk populations would be a prudent thing to do. Do we have to screen AMR staff entering the building in an active code situation? Again, we want you to sort of balance a patient's needs, and safety. And so I know that some of those situations can be a little hard. It might be worth reaching out again to whatever service you would call in an emergency and work with them to sort of reassure, sick people can't come in. And if you're sending people in, can you make sure that they're not sick? And also, if we need to, that they have the right PPE. So, thinking through those scenarios just like you are is great, and reaching out ahead of time is a good thing to do. If you or your spouse has been exposed to a positive person, is there a need to self-isolate? Yes. If you've been exposed to somebody that you think has had COVID-19, we do want you to stay home. There could potentially be some exemptions for that around healthcare workers, but if you have a specific concern, you can reach out to us on that. There's a question about hearing that maybe not all providers have swabs available for samples. We have heard that at times too, and so again, we would advise that you try reaching out to local public health, to your area facilities, and if you don't have those swabs and can't find them, please do let your EMA know so that they can make that request, up through to us so that we know about that. What about employees who travel outside of the U.S. if not in a high-risk country? So at this point, the CDC travel guidance essentially treats all countries outside of the U.S. as level 2. And here in Iowa, we are seeing community spread. And so that does mean that we kind of shift our thinking a little bit, because now that we know that the virus is more present, it's important, really important, more than ever, to exclude people who are ill, because that's really going to be, clinically how we're going to evaluate people, and it's going to be really important now that we've seen increased spread. So there's no longer as much of a tie to international travel, although certainly somebody who says they've been in a high-risk area or around a case would be people that you wouldn't want in contact with your vulnerable populations. But I think it's important to recognize that now that we've seen community spread, it's critical that we exclude people who are ill. What about residents who go out of the facility for appointments and also for family visits? Again, some of the CMS guidance, I think, really advises that those visits be limited to things that are absolutely necessary. So thinking about things that can be postponed or avoided if they're not absolutely necessary, and thinking about whether those people would be going into, high-risk settings, groups, events, really avoiding those things as much as possible. Should local public health or long-term care request test kits to have on hand in case they're needed? Yes, you can make those requests through, to SHL, and if you need help, your local public health. And SHL actually has a link on the website that you should be able to do that through. So if you visit their website, you should be able to do that. There's a question, does a respiratory illness need reported if they have another diagnosis? Yes, we would like to still hear about the respiratory illnesses, even if you have another diagnosis. And those people should still not be at work. They should still be isolated if they're residents, taking the same approach. There's a question, is it mandated that all meals be delivered room to room, or can this wait until COVID enters your county? I don't know. That's not specifically in the CMS guidance, I don't think. I think it's something that at this point we would advise that you certainly consider it if you were to have 2 or more cases of respiratory illness in your facility. But I don't believe that's something that's been mandated by CMS at this time. You could, though, consider, other ways to sort of avoid having large groups of people together, right? So staggering meal times, that sort of thing. There's a question about, are we to continue to transport residents to community provider appointments via third-party non-emergent transportation? Again, I would think about whether you can avoid non-urgent types of appointments, and if people do need to be moving, just making sure that, you're communicating with the transport people or transport, services that you use, and no sick people should be around any of our vulnerable patients here. If the symptom screen is positive for only one symptom, should the employee be allowed to work? No, if an employee is sick with anything for any reason at all, they should not be allowed to work. There's a question about any respiratory symptom, 2 or more without temp should be reported. What IDPH is asking for people to report are any sort of 2 or more cases in a resident or in staff who have fever and respiratory illness. And the reason we're asking people to report that is we're just trying to be as supportive as we can to you, whether we're talking about flu, whether we're talking about COVID-19. We just want to make sure we have that point of connection so that we can offer you whatever it is that you might need to help limit the spread of that. Sorry, can you repeat the COVID-19 answer to when you can return? 7 days from symptom onset, so it has to be 7 days since your symptoms started, and your symptoms must have been improving for 3 days, and you must have been fever-free for 3 days. Is there, and if you have questions about that, you can reach out to public health and we can help you with that. Is there any guidance for employees that are off, that are off due to exposure and their ability to be paid for time off? Those types of situations might be best evaluated sort of with the management of your institution. We want to encourage people to not come to work when they're sick, and so, to try not to be punitive for people for doing the right thing is really what we would like to do, but we know that that's hard. And for healthcare workers, I can tell you that if, as you look at your, pulling out your pandemic plans, as you look at your staffing plans, if you ran into a situation where you had somebody who was exposed but was not symptomatic, if you call us at IDPH and work with us, we may be able to make allowances for asymptomatic exposed healthcare workers to continue to work with masks on, but we'd want to be talking with you about that. There's a question about guidance, again, if staff test positive for COVID, when can they come back to work? 7 days after your symptoms have started, and 3 days during which your symptoms have been improving, and you must have been fever-free for 3 days. What would be the length of self-isolation if you were exposed? We've been asking people to isolate or quarantine themselves for 14 days if they've been exposed. That's the incubation period that we've been working with. Now, again, if there were essential healthcare provider personnel, IDPH can work with you to consider whether or not exemptions can be made. There's a question about, is Iowa working on setting up drive-through test spots? There's not a currently identified drive-through test spot, but we're aware of those kinds of questions, and if we have additional information, we'll share that. There's a question about when and where is this posted so we can share with facilities who can't listen in. This will be emailed back out to people, the recording and the link afterwards, and the link will be on our webpage. Let's see, there's a question about the specific details for swabbing. That link is also on our webpage, and we can make sure that that gets sent out as well. There's a question about, let's see, travel tiers and their risks. So, you know, CDC issues what they call travel health notices. They have level 1, 2, and 3. The U.S. Department of State issues their own travel notices. They do theirs a little differently. The CDC has been adding sort of jurisdictions to those levels over time as we've seen this virus sort of change where it's been coming from. But the CDC has recently essentially said that any place in the world at this point is considered a level 2 or higher. And there are a few other places that are considered level 3. Level 3 means avoid non-essential travel. You know, those are places like Italy, Iran, and China at this point. But in the level 2 for basically any international travel is saying that we've recognized that the spread of this virus is all around the world. And so this is less tied now to a particular geographic area and more about the fact that we've recognized the spread of this virus. And so it's really important to start to take these steps now to limit its spread here in the US. There's a question about an employee who is out of the country on a cruise. Do you need to keep them from working for 14 days? Yeah, that would likely be advisable. Again, we recognize that asking people to stay out of work can cause some workforce issues. And so again, you know, public health is still working with and following up with people to provide this kind of support, but people who have had international travel to affected areas should self-isolate and avoid working with high-risk populations for 14 days. But if, as you look at your workforce, you're starting to have concerns, please reach out to us and we'll talk with you about whether allowances can be made for particular healthcare workers and what they would need to do. If local public health has limited supplies of masks, as we are having our hospital staff receiving the masks, would nursing home staff go through the state instead? Yeah, again, continue to work with your local public health, because if they receive those requests, they can work with you and with your EMA to pass those requests on to us at the state so that we can see how we can support you. There's a question about, is CMS going to allow routine 60-day visits to be postponed to avoid having providers going in and out? Again, you know, I think taking a look at and familiarizing with that CMS guidance would be a good thing to do, and we can look at the 60-day question and see if we can get back to you on that. There's a question about, should local public health have viral detection kits for flu on hand? You know, again, those requests can be made through the State Hygienic Laboratory website to get those kits on hand. There's a question about, what are guidelines for communities that have independent living snowbirds who return to campus? Again, thinking about where people have been, you know, is helpful, and what's going on locally in the communities where they've been, I think would be helpful. But at this point, we really are encouraging everybody to use those social distancing techniques and really limit person-to-person interaction, particularly among our vulnerable populations. So thinking about ways that you can share this guidance, you know, with the folks in your communities and how they can implement it, I think is going to be very important. Again, the criteria for when you can return after being diagnosed with COVID is 7 days from symptom onset, and you've been fever-free for 3 days, and your symptoms have improved for 3 days. There's a question about, can we put the guidance in writing for returning to work? Yes, we have, and we can share that. When does IDPH plan to have updated guidance for healthcare workers exposed a document? Yeah, we have that. We're working on that, and we can share that. And again, it's going to have to do with, you know, your workforce and who you have available, and you know, thinking through ways to keep people out of working with high-risk groups as much as possible, but also recognizing that we don't want to take away all the healthcare providers. And so, yes, we'll provide guidance on how to do that safely. There's a question about, with all travel being considered a level 2, if we have a staff member who traveled to an area without high activity, do we require them to stay home for 2 weeks and self-monitor and social distancing? Again, I think I would keep in mind, so the level 2 CDC travel health notice advises that people with underlying or chronic health conditions, should not travel to those, or should consider avoiding travel to those areas. So I think that if you have anybody who's traveled outside of the country, I would look at what's been going on locally where they are. I would ask them to make sure that they're keeping track of their own symptoms, and if they were to become ill, they should, exclude themselves from other settings immediately. But again, look at your staffing abilities in a facility and think about ways to reassign that person or keep that person as much as you can from working in high-risk settings. There's a question for the recommendation that you have to be 72 hours temperature free. Is that correct? Yes, that's correct. Who will pick up swabs, and is there a contact person or number to send it to? Yeah, so again, if you work with IDPH, if you call us to report that you've got a group of people, who have been sick with respiratory illness, we'll work with you to coordinate that. Let's see. Should you allow staff who have traveled out of the state back into a facility, thinking about people who leave to the southern states for spring breaks? Yeah, again, I think it's important to think about where people have been and what's been going on in the local communities that they've been in, whether they have been around anybody who's been sick, and implementing the screening of your employees sort of on the front end when they come back into the facility. And certainly anybody who's had, an exposure to a known case, or who was in a place where there was a lot of cases circulating, those would be people that, it would be wise to think about asking them to self-isolate. But if they were groups that you really, started to impede your ability to provide care, again, reach out to public health. We can work with you on how to safely do that if you have to, although that's not our preference. And then again, when it comes down to it, the big picture here is really encouraging anybody who's reporting that they're ill with fever, cough, respiratory symptoms, that they should immediately self-isolate and exclude themselves from working with high-risk populations. Let's see. There's a question about, should we increase the questions we ask our employees as we screen them? You're asking about the signs and symptoms of COVID-19 and taking a temp and having them wash hands. I think that's perfectly reasonable. I think I just would add or say, not that you have to adjust your screening questions, but again, big picture, anybody who's sick for any reason with any symptom should not be coming to work, no matter what their job is. And I know that's harder for healthcare workers, and I know that, sometimes there are other challenges there. But again, the big picture here is we don't want people who are sick coming in to work with our vulnerable populations, no matter what it is that they're sick with. There's a question about, is it acceptable for employees to take their own temperature upon entering the facility? Yeah, I think the way that you choose to operationalize this, different institutions will do different things. I don't think that that's necessarily a problem. I think, again, thinking about what makes sense for you and for your employees to get the information and the, the screening in place that you need is a reasonable thing to do. There's a question about, admissions and depending on county of residence. I don't think that I would have any particular guidance at this time about the admission question. I think that what we can do, again, is provide you with that link for the CDC guidance, and I think pulling out your pandemic plan and thinking about if we do see, levels rise or spread of the virus rise in a particular community, what would make sense. I think that's a reasonable thing to do, and we can make sure we direct you to that guidance. There's a question about, will the SHL courier pick up and deliver samples? Yeah, we've been coordinating. IDPH will coordinate with your facility, with SHL, with the courier to help get those samples coordinated and delivered. There's a question about N95 mask use recommendations. So the N95 mask use is still recommended if there's going to be an aerosol generating procedure. So that means intubation, tracheal aspiration, that sort of thing. outside of aerosol generating procedures, it's appropriate and safe to manage patients with COVID-19 using standard contact and droplet protections with eye protection. And again, if you're having concerns about your PPE, please do pass those concerns on to local public health and onto your EMA so that they can get passed on to us if you are having those concerns. There's a question about should we be taking temperatures of the residents since they can't always tell us they don't feel well. Again, I think that's a great question. Thinking about your population, thinking about what is reasonable for them, what they can and can't do, and what's achievable for you and how you can best serve them is exactly what we're wanting you to think through. And so if you think that there may be reasons why they wouldn't be able to communicate that as well, and particularly if you have other ill residents or staff, I think that would be a reasonable thing to do. And there's a question for home care and hospice, and I think we can see there may be some CDC guidance as well that I can pass on to this individual, and we could try and put that in a link for everyone as well. There's a question about if staff has somebody at home with a respiratory illness. If they have somebody at home, again, this is sort of the social distancing idea, right? If you live with somebody who's sick, trying as best you can to stay away from them, although we know that that can be hard, particularly when you live with somebody. As long as this staff member is well, that's fine. But if that staff member were to become ill, they should immediately take themselves out of providing care for any high-risk individuals. There's a question about, do staff that work with residents who are on vents need N95s? No, they don't need to be using N95s unless you're actively intubating or performing tracheal aspiration or that sort of aerosol generating procedure. Droplet precautions with eye protection is recommended. There's a question about improvised face masks if you run out. There are not specific recommendations about improvisation on these materials. If that were to change, we would share that with you. But right now, if you think that you're having concerns about those supplies, again, we do want to hear that. So passing those concerns on to your EMA is important. And we have also been asking every week for facilities to complete a survey on their PPE availability. I think that went out this morning. So that would be another place where, if you can complete that survey and give us an idea of how you're doing, that's very helpful to us. Okay, and it looks like another question about home health guidance, and so we can be sure to share that more broadly, since it sounds like there's a couple more people who would be interested in that. Let's see. Turning now, I'm just looking now for a couple other questions in the chat box. It looks like somebody was looking for the last slide. So we can go back to that, and we'll make the slides available at the end. We'll share the guidance for how long people need to stay home. Some additional questions about not just long-term care, but assisted living. That guidance is part of the mitigation document that I've referenced, the CDC document, but we can make sure we share that, and you should be able to find some of that on our webpage as well. There's another question about what is needed for the testing supplies. Again, we'll make sure that we share the SHL link, and that's where you can go to find the most up-to-date information on what's needed. There's a question about if staff say they have a sore throat with no other symptoms, can they work with PPE? No, the preference is that anybody who's sick for any reason should not be working. Now, if you start to run into staffing problems, looking at your pandemic planning and what you do if you have 10, 20, 30% of staff out, and working with us, to think about who would be appropriate, if you really needed it, we can help support you on those decisions. But anybody who's sick should not be working with our vulnerable populations, regardless of what they're sick with. Let's see. When is it reportable for residents with less than 100.4 but has signs and symptoms of respiratory? You know, we would want to hear from you whether you're having people report objective or subjective fevers and respiratory illnesses in 2 or more staff or residents. And again, you know, we're not trying to be overly burdensome. Our goal here is just to be as supportive as possible, you know, and help you in any way that we might be able to. Are there restrictions on travel within the United States for staff? No, there are not currently any restrictions on travel within the US. A question about if somebody has a cough but no other symptoms. If somebody has developed a new cough, again, if somebody has a new symptom of illness of any kind, the preference would be that those people should not be going to work. You know, whether it's COVID-19 or flu or anything else, we just don't want, you know, our high-risk people to be around anybody who's ill for any reason. There's questions about people who may have a chronic cough or respiratory illnesses. You know, that's a little bit harder. I appreciate that. You know, part of it is going to be about really asking your staff to, you know, let you know if they have changes in their baseline or new symptoms. But if there are other people or particular situations that you're concerned about, you know, you can work with that, you know, you can have individuals work with their healthcare provider and also work with local public health. There's a question about waivers for long-term care for staff. I don't have specific information on that, but we can follow up with you afterwards. We can follow up and share that with everybody. The question is about guidance for people who took a cruise, you know, regardless of the location. So the current travel advice from CDC is that everybody should avoid taking cruises at this point. CDC has advised that travelers defer cruise travel of any kind. Now, certainly individuals who have been on a cruise that's been associated with an outbreak of COVID-19 would be people who'd be at higher risk. People who've been on a cruise that landed or docked in a high-risk area would be people that would be at higher risk. But anybody who's traveled, you know, internationally at this point would be people that we'd want them to keep an eye on their symptoms, keep an eye on their health, you know, and if they were to become ill, to sort of make sure that they self-isolated immediately. And that's sort of the general advice for everybody at this point, right, is for all of us, if any of us are feeling ill for any reason at all, you know, we need to make sure that we're staying away from others, using those social distancing techniques, staying home if we're mildly ill, and calling ahead to our healthcare provider if we think we need care. That's really going to be the advice for all of us at this point, because we've recognized that the virus is spreading in the community. If our facility is managed, should we be allowing the management company to come into the building? You know, I think, again, working with your management company, reviewing the CMS guidance, and thinking about, you know, things that are non-essential, you know, limiting those non-essential activities as much as possible, you know, is really what we're asking people to do. There's a question about the current status in the state. There are currently 22 cases of COVID-19 here in Iowa. There's a question about who will pay staff if we mandate them to stay home. I know that that is hard. I think thinking through your organization, reaching out to management and working with your organization structure to think about what are the plans for people who are sick, who can't come to work. You know, this should be part of the pandemic planning that you have in place, and thinking about what that looks like for your facility now would be a good thing to do. There's a question about how to define a fever. Is it 100.4? I think 100.4 is generally what I would use, but we would accept people reporting subjective or objective fever. There's a question about swabs and testing, and again, we'll provide a link as a follow-up to the SHL website. I know that this is a little challenging because it has changed over time. It used to be 2 swabs for COVID-19, and now it will only be 1. Is the guidance still fever-free? Oh, pardon me one moment. What? It sounds like we're getting questions about whether people have to call IDPH to see if their patient needs testing. No, you don't have to call IDPH to ask if patients need testing. If you're worried about patients, an individual patient's health, you should still be working with the patient's provider and with your own institution's medical director. When we want you to call us is if you have 2 or more cases of a respiratory illness in staff or in residents, and we're asking you to call us with that because we're trying to get at whether or not you think you have a cluster of respiratory illness in your facility, because we want to help you with that. So you don't have to call us to evaluate every single individual patient. You should still work with your own internal providers and medical directors. The request to call us, and this is posted on our website and it's on the screen now, this is just us trying to understand if you're seeing clusters of illness. That's what we're trying to help with. Let's see, going back now to our other screen for anything else. There's a question about the guidance about mass gatherings and the definition of 250 and 50. So, you know, some documents have shared 250. Some of the CDC's early mitigation documents shared 250. And then, of course, last night, CDC has, you know, shared 50. And I know that that can be really hard. And I'll be honest, you know, the number, when we think about a group setting, you know, it's important, but it's also important to think about a few other things when we think about groups. So in addition to the number of people, we want to think about, is our group made up of mostly high-risk individuals? And for many of your facilities, that's probably going to be yes. So, you know, maybe even below 50, we want to sort of consider not having those kinds of gatherings, which is why we talk about canceling, you know, unnecessary communal events. We also want to think about, where's the event being held? Is it in a location where people are able to practice social distancing, right? Can we be more than 6 feet apart from each other? Or are we all going to be very close to each other? How long are we sitting, you know, next to each other? Is it a couple of minutes? Is it several hours? You know, taking into account, you know, a variety of those factors. But we will go ahead and share, you know, the guidance that's come from CDC as well, related to events around 50 individuals, as well as some of those other factors to consider, particularly when we think about our high-risk groups. There's a question about testing. Again, you know, if you visit the State Hygienic Laboratories site, you can complete the test request form electronically for people who meet the criteria that we've listed there, and many of your population are going to fall into that criteria. Individuals should always work, you know, but either by calling or being evaluated by their healthcare provider to come up with who's appropriate for testing. And there are currently available, you know, commercial lab testing that can also be done outside of the State Hygienic Laboratory. There's a question about handling outpatient therapies like physical therapy. Again, thinking about whether non-essential visits can be postponed would be important. You know, and I know that's hard, but just being thoughtful about balancing the risk to a high-risk individual and the setting that they're going into, you know, and making sure that we limit the goal here. Again, we're trying to limit as much as we can, you know, sick people being around our vulnerable populations, because this is the group that we know is at highest risk for complications. And so we're just trying to think through all the ways we can kind of reduce the likelihood that that will occur. There's a question about travel restrictions within Iowa. There are no travel restrictions within Iowa. There's a question about hair salons. You know, again, avoiding non-urgent appointments at this point is what the advice is. There's a question about prevention and recommendations on prevention. Again, I know that this sounds overly simplistic. People need to wash their hands frequently with soap and water. People really need to stay home when they don't feel well for any reason. And I know that's hard, because sometimes, you know, we only feel mildly ill and we think to ourselves, well, I'm not that sick, so it's okay. And for 80% of people, that's going to be true, right? But it's that higher risk group, that 15 to 20, the people that you have in your facilities that are at higher risk. And so even for people who feel only mildly ill, it is critical that we all stay home when we don't feel well. That is going to be the most important thing to reduce the spread of this illness or any other illness. Let's see, going back to our other, there's a question about, the social distancing radius. There have probably been, you've probably heard different numbers used at different times. The number that we're using right now is 6 feet. That's what we're advising for getting 6 feet of space between yourself and somebody else. I think that's everything that we got through here. Again, I know we've got a number of things that we'll be sharing to follow up with on. I just want to say thank you again to everybody for making time to join this webinar, for the questions, for the feedback, and for all the work that you're doing to take care of Iowans. We really appreciate it. We know this has been a quickly evolving situation. Please do continue to check our webpage for updates, and we will continue to share information as it comes along. Thank you all, and have a good day.